Hello, I'm Hahirwabasenga. I'm doing my bachelor in healthcare management with communication concentration. I'm going to present some of the answers that have been asked and in my final panel review. We have been asked about 3 goals, where I will start on the goal number 1, which is about ensure healthcare quality. To start, I would like to share with you what I learned from this goal. Within this goal, I learned different things on what can be done to improve daily care among the people. Where, for example, I learned that when you have a problem, have first to set up the goal on how the problem will be solved. Like if you have the problem of insufficient water within your body, have first set up the goal of drinking like 4 liters per day. When you are done with setting up the goal, you have also to start breaking it into small processes that will help you to achieve your goal. For example, you can say, if I have the goal of drinking 4 liters per day, I will be drinking 1 liter in the morning, 2 liter at noon, and also 1 liter in the evening. That will help you to achieve your daily goal of drinking 4 liters per day. I also want to make sure that the people are being given the better healthcare, where there must be the health licensor, where the healthcare professionals, individuals, organizational, are given the permission from the government to operate in certain setting. Also, where this helpful licensure is very important because it helps the people to protect the public health and safety. This is because the licensure is given after the inspection done by the government or other institution to see if certain organization or healthcare setting has all requirements that allows them to operate. I have also learned about how to help people who are old, where there must be the nursing home, which is a place where the elderly people who don't need to be in the hospitals can be treated and cared for 24 hours a day. The quality management is very important in healthcare settings. It means that I've gone to the second question, which says, why is quality management important in healthcare settings? It's very important because it helps to minimize the medical errors, which kills thousands of people all over the world every day. To also play a great important in enhancing the accountability of healthcare practitioners and managers. This goes with setting the rules and regulations which governs all healthcare professionals. For example, within the healthcare setting, where there is the quality management, the healthcare practitioners can go on chat while the patient are waiting the outside. Like, for example, going on phone, chatting, conversing with their workers. When the patient are outside waiting for the treatment, it can lead to many deaths from those patients because of poor treatment. Another question says, what are the most pressing issues in quality management in healthcare sectors in Rwanda? Here in Rwanda, the quality management healthcare sector in Rwanda, the most pressing issues which I found include bad treatment for those people who have the public health insurances known as Mutuelle de Santé. For example, when you have the public insurance known as Mutuelle de Santé, there are many hospitals where you are charged 100% when you go to for treatment there. This is still a big problem in the healthcare industry in Rwanda. Another issue is that when you go in rural areas where the private healthcare institutions or hospitals are to you, a person can die of lacking the treatment. This is that from those people who are transferred to the main hospitals from health centers, they are in critical conditions. Sometimes it takes a long time to reach those hospitals, and when a patient or the person is in critical condition, he may die when he's still in the way going to the hospital in which he or she was transferred to. Another question says, explain one of the quality improvement models and show it how it can be used in addressing the pressing issue raised. I think that one of the quality improvement models is using PDSA cycle, which consists of planning, do, study, and act. To start by planning, this is the way it is the way the objectives of the problem will be formed and try to identify what can be done to solve those problems. It means that within this problem of those health centers and rural areas where a person can die when he is transferred to another hospital because of the high long period of time. It means that here we start by planning the objectives, then we even do the part. That is where the plan and documentation of the problem are made, and also the analysis of the data. Try to analyze what can be done so to minimize those transfers, and also to minimize, and also to make sure that the hospitals are near by the people, so that they can make a long journey to be treated. Have also the study, which is about completing the analysis of the data. Within this part, there is a comparison of the data to prediction and also the summary of what is around. The fourth one is act. This is like the implementation. It is where all possible changes which can help to get the possible solutions to the problem identified. It means that after analyzing the problem, you plan, then you also set up the solutions, then you implement it. It means that when you are at this phase, the problem is like it is needed to be solved. After this, let's go to another goal, which is utilize healthcare data. Some of the questions I've asked to this goal, it says, with an example, define healthcare informatics, some ethical issues related to healthcare informatics in Rwanda. Healthcare informatics is a system which uses information technology to organize and analyze health records to improve healthcare outcomes. Some of the ethical issues related to healthcare informatics in Rwanda is that first, it is expensive, whereby some of the healthcare institutions can't manage to afford those healthcare informatics. Another one is privacy and confidentiality. Because it's recording data electronically, some of the people outside can come and see the information, which is also an ethical issue. Another one is clinical challenge, whereby internet can be cut off, and also another technical issues, which can also make the delay in recording those information. Then to go to another goal, which is addressing aging and end of life. I've been asked, what do you understand by term end of life care? This term it refers to the health care for a person which with a terminal condition that has become advanced or progressive. It means that, in other words, it refers to the support for those people who are in the last month or the years of their life. End of life care helps the people to die with dignity. This is because the people who are taking care of you ask you about the wishes and your preferences, and then they build on them to take care of you and also try to fulfill all the needs that you want to make sure that your health is in better condition. Then, what are the best practices to provide the end-of-life care to aging people? The best practices include setting the care home or hospices where the aging people can be treated without leaving their homes. Then, providing the information about outcomes, risks, and benefits of palliative care to the aging people. Then, the last one is about some ethical issues associated with the provision of end-of-life care here in Rwanda. Some of the ethical issues, the first one is that those old people who don't have the family members taking care of themselves, they can die from home when they miss the home treatment. This is because in Rwanda, there is no that program of home nursing where the nurses or the other healthcare practitioners can go to the people's home to treat them without the movement of those old patients from their home. Then another ethical issue comes when there is an advance medical directives, where those people who don't have their family members or other people to take care of themselves, the healthcare professionals are the ones to take the final decisions about their treatment. It means that because there is no one who can send the advanced medical directives, the one who is treating him or her, I mean the healthcare professional, will be the one to take the final decision about her health treatments. Thank you so much. This is the end. Let's meet again in